19 immunohematology principles. So in that 19.1 ABO blood group system and other blood group systems, and 19.2 different techniques like blood grouping, cross matching and Coombs test.
Hello students, welcome to this session. So today we will study blood group. So what is blood group? So they are red cell antigens. So the antigens present on red cell give the blood group characteristics. So this opposite of to that is the antibodies present in serum. So they are called as natural antibodies, and immune antibodies, if they are produced because of the antigen is not present in blood, and if it is introduced into the blood, then it produces antibodies. They are called as immune antibodies. Now we will see types of blood group systems. So there are mainly two types of blood group systems in Indian station. So it is ABO system and RH system. So in ABO system, mainly four types of blood groups are there: A, B, AB and O, according to the antigens and antibodies present, that we will see later on. And the second system is RH system. So RH positive blood is called as when the D antigen is present, and RH negative blood is when the D antigen is absent. So in this chart you can see group, antigens present on RBC and antibodies. So in A group, A antigen is present on RBC and anti-B antibody is present in serum. In B group, B antigen present on RBC and anti-A antibody present in serum. So it is opposite of the antigen, that antibody is present in the serum. So these anti-A and anti-B, they are called as natural antibodies. In AB group, A and B, both antigens present on RBC, so no antibody present in serum. In O group, antigen is not present, either A or B, so anti-A and anti-B, both antibodies are present in serum.
So inheritance of blood group depending on the antigens, so phenotype and possible genotype. So in A group, there is AA and A0. O group, no antigen, that is 00. B phenotype, BO and BB. AB phenotype, that is AB.
Now methods of ABO blood grouping. So they are mainly two methods, forward and reverse. So forward is also called as cell grouping and reverse is also called as serum grouping. So in forward or serum grouping, we have to take cell suspension, RBC of the patient, and then we have to add known antiserals. And in serum grouping, you have to take serum of the patient and you have to add known cells of the from the kit. So and then we will see the clumps. And for RH blood grouping, only forward grouping is there, that is cell grouping. Reverse grouping is not there because natural and anti-D antibodies are not there. Some points about Bombay blood group. So it is discovered by Bhende. So normally H antigen is present, it is seen in saliva, seminal fluid, so it is also called as secretory antigen. So if H antigen is absent, then you will see anti-H antibodies in the blood. So normally it is H antigen present in blood, so no anti-H antibodies are seen. But in O group, if O positive, then the anti-A and anti-B, both antibodies are seen in O group and no antigen. So OH, that is Bombay blood group, anti-A, anti-B and anti-H antibodies are seen because H antigen is not there. So when O group is given to the O patient, but if the patient is Bombay blood group, then this anti-H antibody will react with the H antigen present in the patient and there will be lysis of the blood. So the Bombay blood group patient should get Bombay blood group donor. So now in short, principle of blood grouping is when antigen and antisera, they are mixed together, they forms agglutination or clumps, and then we can decide the blood group. So in short, forward method, it can be done on slide or tube method. So you have to take 1 drop of blood and then 1 drop of known antisera, that is anti-A, anti-B, and add these two, wait for 2 minutes and see for the clumps. So if the clumps present in anti-A and no clumps seen in anti-B, then it is A group. If clumps present in anti-B and no clumps in anti-A, it is B group. If clumps seen in both the anti-A and anti-B, then it is AB group. And if no clumps seen, it is O group. So O group means it is 0, no antigen. Now in reverse method, you have to take 1 drop of serum and then you have to add 1 drop of known A cells, B cells and then see for the clumps. If you are taking this in tube method, you have to mix and centrifuge and then you can see clumps. So now here interpretation is opposite. So if you see clumps in A cells, it is B group. If you see clumps in B cells, it is A group. If you see no clumps, then it is AB group. And if you see clumps in both A cells and B cells, it is O group. Now we will see significance of blood group. So significance of blood group, the blood group, everyone should know their blood group, because when in accident or in surgery, when too much blood loss is there, then we need blood. So which blood to be taken from donor, we should know that to prevent the hemolysis of the blood or mismatched blood transfusion. Again in pregnancy also, mother and father blood group should be there, because if mother is negative, if father is positive, then if baby is positive, then that D antigen will cross to the mother through the placenta, and in next pregnancy, because of the anti-D, the immune antibodies are formed, and in next pregnancy D antigen of the fetus will react with the anti-D antibodies and it will cause hemolytic disease of newborn. Again for identity purpose also, for medical legal purpose also, this blood group should be known. Now little bit about Rh antigen. So Rh antigen, it is discovered in rhesus monkey, and when 1 drop of blood is taken, 1 drop of anti-D from the kit and see for the clumps. So if you see clumps, it is Rh positive. If you see no clumps, it is Rh negative. And natural Rh antibodies are not present. They are immune antibodies. When the Rh negative person gets exposed to Rh positive blood, then there is formation of antibodies, and then that is called as Rh antibodies. So it can be seen in mismatched blood transfusion or hemolytic disease of newborn.
Hemolytic disease of newborn. So when Rh negative female marries to Rh positive husband and conceives Rh positive fetus. So Rh positive RBCs of the fetus enter maternal circulation and stimulate Rh negative antibodies in mother. So they are immune antibodies and they can pass through the placental barrier, and then next time when pregnancy is there, they cause hemolysis of fetal RBC. So this is called hemolytic disease of newborn. So manifestations can be abortion, intrauterine death, child born with jaundice, edema, ascites. So prenatal diagnosis, blood grouping of husband and wife, and if Rh negative mother, detection and titration of Rh antibody in maternal blood by ICT, that is indirect Coombs test. Postnatal diagnosis, DCT on the direct Coombs test on infant's blood to detect sensitization of RBC, blood grouping of fetus, then HB, PBS, serum bilirubin, reticulum, and the signs of hemolysis, management, exchange, transfusion.
So the significance of cross matching is to prevent transfusion reactions like hemolytic reactions which occur because of the mismatched blood transfusion. So now types of cross matching, there are two, major and minor. So in major cross match, donor cells are mixed with patient serum. So in that, donor's antigen is going to react with the patient's antibody. In minor cross match, patient cells are mixed with donor's serum. That means patient's antigen will react with the donor's antibody. Now see the steps of cross match. So first we have to take these cells and serum suspension in saline and keep at the room temperature for half an hour. Then these test tubes we have to keep at 37 degrees Celsius for half an hour. Then we can add bovine albumin 22% and keep test tubes for half an hour in the incubator. Then we can add papain enzyme and then again keep the test tubes in the incubator, and finally we can add Coombs serum, that is anti-human globulin serum, in the test, and then keep that for the half an hour in the incubator.
Coombs test. So there are two types, direct and indirect. So direct Coombs test detects antigens on RBC, uses hemolytic disease of newborn and hemolytic anemia and mismatched blood transfusion. Indirect Coombs test detect antibodies in plasma or serum. So uses blood grouping to confirm Rh negative group. DU test is done similar to ICT, cross matching using Coombs serum and mismatched blood transfusion reaction. And then antibody D titer, when indirect Coombs test positive, titration of antibodies is required. So it is the highest serum dilution which shows agglutination. So significance, rising titer anti-D antibody indicated occurrence of hemolytic disease of newborn.
Hope you find this session useful for your understanding and for your exams. Thank you.